or almost good afternoon. So I'm sure a lot of us can remember a point in our education or in our training when we just wanted to throw down the books and say, I want to do something big. I want to change things. And I know that I've felt that way being in the library at 1 a.m. before, which is all too often an occurrence for me. But we are lucky to have those opportunities in Nashville. It's a larger city, unlike where I'm originally from in Philadelphia. And no, I don't mean Pennsylvania, I mean Mississippi. It's a very interesting town of about just 10,000. You probably know it for one of two things, maybe. One, we are the site of the Choctaw Indian Reservation, and two, the site of the infamous, tragic 1964 Freedom Summer civil rights murders, which the victims were fortunately at least partially vindicated in 2005, if you were keeping up with the news. But what I want to talk to you about is the fact that I fled, of course, and I went to Vanderbilt for undergraduate, and now I'm in medical school, and I want to ask you the question, is it possible to impact someone's life just as a medical student, as a student of any kind, without having 36 hours in a day, because I spend 25 of them already studying? And so how do we make a difference, and how do we impact people in a way that's going to be productive? And there's actually a remarkable story for that. Several years ago, medical students founded what is now known as the Shade Tree Clinic. And this clinic is in East Nashville, and they identified a subpopulation of people, a demographic that is very disadvantaged, not insured, and they saw a need, and what they did was sought to actually help these people in a very real way. In the beginning, it started out just as a very small group of people. We are a completely student-run clinic. It is supervised by attending physicians. Student teams see patients, and we're always trying to learn from our experiences, but help these people at the same time because there's nowhere else that they can go. We work out of a double-wide trailer, very limited resources, but we do the most with what we can. We have a patient load of more than 1,000. And we do this through this small clinic here. We have a fully stocked pharmacy. Students run that as well. All their medications are free. Their prescriptions are free. Their medical treatment is free. We do everything from HIV tests and flu vaccines to ultrasounds and referrals for counseling, etc. And if we're talking local, this is about as local as you get. We are located just across the river, as we say in Mississippi, spitting distance of where we are right now. And it's a very, I have learned so much from it. And I want to tell you, I think this is interesting. If we look at the demographics of this clinic, in the 2000 census in Nashville-Davidson County, we were 63% Caucasian and only 5% Latino. The demographic that we serve at clinic at Shade Tree is quite different from that. We have 35% Latino patients and 38% African Americans, so very disadvantaged here. The health disparities are immense. They are very real. There is inequity with regards to healthcare in this country, and with regards to most other things as well. Gender equality, as we've heard, it's very prominent here as well. 35% of those patients are uninsured. They would have no other way to receive adequate health care. Also, 14% choose not to seek treatment for their non-emergent conditions, and most of them, or almost most of them, chose the ER as their primary care, which of course is a burden to our healthcare system. And 83% believe that they would not have services and health care without our clinic. So we're actually life-saving to 83% of the people that we serve. Even with respect to chronic disease, these are schematics of Davidson County with reference to hypertension and diabetes, and you can see that some of the densest prevalence areas of diabetes and chronic disease, other hypertension, all of these things, is focused largely on the demographic that we serve, which is outlined in the gold box there. So we serve a very huge number of people that suffer from chronic disease and would have very debilitating lives without our care. Prescriptions. Our clinic, we have 1,000 patients. Our prescription number goes up every month. We fill about 400 prescriptions on a monthly basis at least anymore, and that number keeps growing. Our clinic is staffed by first and second year medical students for the most part, and we have several different departments. We do health fairs in the community. We do glucose screenings, hypertension screenings. We refer out for counseling and things like that. We're represented all throughout the local neighborhoods and throughout Nashville itself. And also, we can hardly expect our patients to do what we ask them to do and to have healthy diets and to eat nutritiously if we don't give them a way to have that. And so what we've done is the Vanderbilt Educational Garden Initiative is a medical student-run initiative, and we have made a garden, revitalized an area right outside of clinic so that our patients can come in whenever they want, have fresh fruits and vegetables that they can pick where they wouldn't otherwise have it, because this area is definitely a food desert. And it's not the best location to eat nutritiously. And social work is what I direct at clinic. I'm the director of social work, and it's kind of my position. We offer a comprehensive approach to health. We look at the holistic person, and what we do is not just medicine specific. We look at a patient's entire well-being. And so what we do is we look at a patient's entire way of life and build that around their medical management. And so everything from disability to food stamps and vision and dental assistance to domestic abuse resources, immigration and legal aid, mental health, all of these things we use, and we use the resources that we have, and we try to get these patients the help that they need to live better lives. We get them financial help. We get them help with cataracts extractions, wisdom teeth extractions, all of these things that they would not otherwise have had. And this is all just right across the river in East Nashville with a patient load of about 1,000. So I ask you, is it possible to impact someone's life as a medical student, any kind of student at all? And that answer is, of course, absolutely. And I'm very privileged to be able to work with these patients. And it's a great thing. And I am able to give hope to so many people that otherwise wouldn't have it. Our entire team gives hope to people that would be suffering from chronic disease and would not have a way to live their life the way that they had once hoped to. And on the same token, medical students are able to become better doctors for tomorrow and work with patients that give us hope as well to actually change this world, indeed on a very local level. So thank you so much.